Hi, I'm an endocrinologist. I'm a graduate from the University of Chicago. I'm a physician who specializes in glands and hormones and how they impact bodily functions like metabolism. My duties are providing care for people with chronic diseases and helping people with diseases like diabetes understanding the limitations of their disease. I often order tests and prescribe medication like insulin to type 1 diabetics. To become an endocrinologist, you will need a bachelor's degree in biology, medicine, or chemistry, and you will need to complete a 4-year residency, as well as have a medical license state issued.
Biomes decrease the amount of insulin that is produced inside the liver, causing the blood sugar levels to decrease. Metformin is a type of vitamin that makes muscle tissue more responsive to insulin. So when the muscle tissue senses high amounts of it, extra glucose is absorbed into the tissue. Metformin is taken twice a day, and a side effect of it is occasional diarrhea, but that's only when not taken with food. Rosiglitazone and pioglitazone are TZDs that can help decrease the amount of glucose produced in the liver. They also reduce A1C levels in the body with very few side effects. Similar drugs have shown side effects of serious liver problems, but rosiglitazone and pioglitazone have not shown this, and scientists are keeping an eye out to make sure that does not happen to these drugs. But both drugs are showing very limited side effects.
Type 2 diabetics may need to use insulin if their new diet and exercise plans, anti-diabetic drugs, and weight loss are not effective in regulating their blood sugar. Insulin should only be administered if their A1C test result is greater than 7.0% after 2 to 3 months of oral medication. For type 2 diabetics, injecting a basal insulin injection once a day is best. Insulin injections could either be used with an anti-diabetic drug or it could completely replace it. The longer someone has type 2 diabetes, the more likely they will need to take it. A type 2 diabetic may need to take insulin because it can bring blood sugar down much faster than diet and exercise. If your blood sugar is dangerously high, then you might take insulin to lower your blood sugar. Even if one is taking insulin, they should always watch what they eat and drink. It has less side effects than other medications, since insulin is just a version of the natural hormones in our bodies. Someone's body will accept it better than other medications that have chemicals that do not naturally occur in our bodies. And it is also cheaper to use insulin than to take other medications.
Multiple types of insulin. Some types include rapid acting, regular, intermediate acting, long acting, ultra long acting, combinations, and inhaled insulin.
Rapid acting insulin, they have an onset of about less than 15 minutes. They have a peak in about 30 to 90 minutes, and they have a duration of 2 to 4 hours.
Regular acting insulin has an onset of half an hour, a peak of 2 to 3 hours, and a duration of 3 to 6 hours.
Intermediate insulin has an onset of 2 to 4 hours, a peak of 4 to 12 hours, and a duration of 12 to 18 hours.
Long-acting insulin has an onset of several hours, minimal or no peak, and a duration of 24 hours or more.
Ultra long-acting insulin has an onset of about 6 hours, there's no peak, and has a duration of 36 hours.
Combinations combine intermediate acting insulins with regular insulin and are convenient for people who need to use both.
Inhaled insulin became available in 2015 and is used in combination with long-acting insulin. It has an onset of about 12 to 15 minutes, a peak of 30 minutes, and a duration of 3 hours. Insulin is most commonly supplied in the U10 version. This means that for every millimeter of fluid, there's about 100 insulin units. U40, it was kind of phased out in the world, but it can still be used for animals. And U500 can be used for patients who are extremely insulin resistant.
Insulin pumps are small computerized devices that mimic the way human pancreas works by delivering small doses of short-acting insulin continuously, which is called basal rate. The device also is used to deliver variable amounts of insulin when a meal is eaten.
Advantages of these insulin pumps are that you'll need fewer needle sticks, which is always a good thing. The pump is more accurate than actually measuring out the dosage yourself. It helps you manage it also helps you manage your blood sugar better than the needles, and it may improve your A1C levels. And also, dosing for snacks and meals is much easier than having to inject yourself.
Some disadvantages are people gain weight due to insulin pumps. so the body doesn't lose glucose through urination. You can get into trouble if your insulin pump just stops working and you might not have needles with you. And another disadvantage is if you don't get insulin for several hours, you can develop a dangerous condition called ketoacidosis. And insulin pumps are very costly, exceeding up to over $1,500 per year for one insulin pump.
Although insulin is already very advanced, scientists are constantly working to improve the technology used to treat diabetes. And although type 1 diabetes cannot be avoided, type 2 can. Ways to avoid it would be eating healthier and avoiding excess carbohydrates.
You could also have more physical activity throughout the week to stay fit and healthy. The symptoms of diabetes include excessive thirst or hunger, fatigue, headaches, or excessive urination. If you have any of these symptoms, visit a doctor or an endocrinologist.